All right, so here's a hot take for you. I've been hearing the term microdosing more and more in the aesthetics industry, whether it's microdosing skincare or retinoids, oral medications, or even injectables like Botox. The idea is that by using very tiny amounts, you'll get gentler results without the risks. And while it sounds appealing, I'm here to tell you I don't microdose with myself or my patients on anything, and here's why. So with prescription strength skincare ingredients, the dosing and frequency are carefully studied to achieve meaningful, safe results. Using too little, too inconsistently, or in an unregulated way often means you won't see the benefits you're hoping for. And in some cases, you may still experience irritation without achieving visible improvements. And when it comes to in-office treatments like neuromodulators or wrinkle reducers like Botox, microdosing can be even riskier. Results may be unpredictable, short-lived, or cosmetically unsatisfactory, which often ends up costing more in the long run. Even more so, I've been hearing more about people trying to microdose GLP-1 medications like semaglutide or tirzepatide, which I strongly advise against. These medications were designed and clinically tested at very specific doses to deliver safe, consistent results. Using too little not only renders the medication possibly ineffective, but it can also lead to unpredictable side effects, resistance, or rebound weight gain when dosing is not properly supervised. You may experience nausea, gut irritation, or blood sugar fluctuations without ever achieving the cardiovascular and metabolic benefits these medications are intended to provide. I mean, talk about a waste of time and money. And when it comes to hair loss, minoxidil, whether in topical or oral form, is a scientifically studied treatment for hair loss. The dosing and frequency have been carefully researched to strike the right balance between efficacy and safety. When patients attempt to microdose minoxidil, they often end up with the worst of both worlds. Not enough medication to stimulate meaningful hair growth, yet still at risk for scalp irritation, shedding, or changes in blood pressure. Too little minoxidil will not push follicles into the growth phase long enough to see visible, sustained improvement. And inconsistent or microdosed use can even cause frustrating shedding cycles. And last, but certainly not least, Accutane, aka isotretinoin, is one of the most powerful and effective treatments we have for acne. But it works best when prescribed at an evidence-based dose and for a set course of time. At the subtherapeutic levels that microdosing provides, the medication often isn't strong enough to fully clear acne or keep it from rebounding back. Patients may end up frustrated, stuck in a cycle of persistent breakouts, and exposed to side effects without ever reaching the lasting remission that standard dosing provides. Even more importantly, Accutane is a serious medication that requires careful monitoring for side effects, including lab work monthly and strict pregnancy prevention. Stretching out low doses over months or years can increase the burden of long-term exposure without the proven benefits of a proper treatment course. I think you're starting to see the point here, but it truly boils down to the fact that as a board-certified dermatologist, I believe in tailoring treatments and recommendations to your skin's unique needs using evidence-based dosing, not guesswork. My goal is always to deliver safe, lasting, and beautiful results, which is why I do not recommend microdosing for anything as a shortcut in the dermatology or wellness fields.